Fast Cargo caters for all your door-to-door sea and air cargo services from Nigeria to the UK and UK to Nigeria. With prices from 99p per kilo, you can't go wrong. For prompt, efficient and dependable service, call Fast Cargo today.
Welcome to this week's edition of Health Corner on Ben TV. I'm Dr. Okpaka. Today we're going to talk about ear infection. We have a consultant in ear, nose and throat, Dr. Nnaemeka, who will be telling us more about this common condition. Dr. Okpaka, you're welcome to Health Corner.
Thank you very much, Dr. Okpaka, and thank you for inviting me to this program.
Yes, I'm sure the viewers will be watching to see what you're going to tell us about ear infections. I know ear infections are common, they affect children, they affect adults, and there are other things that we have to know about regarding ear infections. Are there things we should know about when it comes to ear infections?
Thank you very much for inviting me to this program today. The ear infections are really very, very common, especially around this time of the year. Now, ear infections commonly can be divided into two. You have otitis externa, which means infection of the ear canal, and also you have otitis media, which means infection of the middle ear. Right. So we're talking about behind the eardrum.
All right. So if we start with otitis externa, which is infection outside the eardrum, is that right?
Absolutely, that's right. Correct. Yes. Yeah. So infection, acute otitis, I'll start with otitis externa, where you can have like anything acute. Acute just means that you have the infection coming up very sudden and almost all the time with pain. And actually, otitis externa just means inflammation of the ear canal. So the ear canal gets inflamed, and of course, you've got a lot of different reasons why you can have it. Now, basically, in a lot of times, it could be infective. So we're talking about infections causing it. And when we talk infections, we can talk about viral infections, we can talk about bacterial infections, or we can talk about fungal infections. At the same time, we can also have a reactive. And when I mean by reactive means that there is something else happening underneath that actually predisposes or leads to that happening.
So there's an underlying disease.
Absolutely. It might not be a disease. Right. It could be a predisposing underlying factor that makes that person very likely to have that.
So things like eczema, right?
Absolutely. Things like eczema. Actually, sometimes people call otitis externa eczema of the ear canal. Right. And at the same time, you might have people who have all sorts of allergy. For example, people who have what you call seborrheic dermatitis. So that means they have some form of allergy affecting the canal, so that if anything touches on it or reacts to it, it now can lead to that.
All right.
And also, before we go back to the infections, it's probably best for me. We say that before you say anything, you've got to talk about anatomy. And anatomy means just tells you about the structures. So the ear canal itself is about 24 millimeters long. And actually, when you look at the ear canal, it is slightly complex because the outer 40% is made of cartilage. And cartilage is the kind of, for example, if you touch your ear, that's all a kind of cartilage as well. Right. That goes into the ear canal. Then you find out that the inner 60% is bony canal. Right. And actually, I'll come back to that because that has implications or explains why we have some of the symptoms we have, like, for example, pain. And going to that, we can talk about, I'll go to predisposing factors. Why do people have otitis externa? You see, because otitis externa, you think of it, is commoner in adults, while otitis media is commoner in children.
That's the inner ear one.
The inner ear one. But I'll come to that because, again, the anatomy and some of the predisposing factors will explain why you've got a lot more in adults. Now, what are the things that can have it? The lining of the skin of the ear canal actually protects the ear canal. So if you have a break, like for example, you can imagine if you've got eczema, if you've got some like itching, or if you've got trauma, we use of things like cotton bud, which is why we always say, if you come to an ENT, by a clinic, ear, nose and throat clinic, like come to see me, one of the first things I say is, do you use cotton buds? So the first lesson from here is, do not use cotton buds.
Right.
Do not put anything into your ear canal because it could predispose you to otitis externa.
You know, people keep itching their ear.
Absolutely.
Using different objects, plastic.
Absolutely, that's not good, because if you have any break in the ear canal straight away, it can lead to infection.
What about using the fingers? You know,
I would say don't use fingers. I tell people, if you have any itching, get Vaseline, just rub it around the areas, or you can just put your finger just there, or use a serviette to clean, but don't put anything inside. I think that's lesson number one.
That's a very good one.
And then the other thing again is that you can have problems in the environment, like for example, you have a number of people who've gone overseas for holiday, gone swimming, ended up with ear infections. So that's another previous, which is why sometimes people call it swimmer's ear as well. You might have heard that terminology.
Correct, yes.
And even when you've got varying weather conditions, increased humidity, sometimes even when you've got something like wax impaction.
Yes.
Now, second lesson about the cotton buds.
Yes.
If you use cotton buds into the ear, you're more likely to impact wax. So that's the second reason for not using cotton buds.
That means that we're likely to push it in.
Absolutely. Yeah, because actually what happens is that the ears have a self-cleansing mechanism, and so the wax forms out and clears itself.
Right. Okay.
Now, I talked about, you can also have some classifications. Now, most of the time, the otitis externa would be diffuse. That means it affects the whole ear canal. But sometimes, it can be localized. So it's localized to a part of the ear canal, almost like having an abscess. And that is what we call furuncle.
Right.
That can be very, very painful.
All right.
And for that, the patient needs to be started on some form of antibiotics and probably needs to come to see someone like me to get it sorted. Has to see a specialist or something like that. And of course, I talked about the bacterial. You can have things, I'll just use some of the terms. There's some common bacterial infections like Pseudomonas, common one like Staphylococcus, and even when you have someone like fungal, one also called something like the Candida,
That's
the
yeast,
fungal.
isn't it?
Just the yeast, absolutely, yes. Yeah.
Right.
And how do people actually know they've got otitis externa, acute otitis externa? The first thing is that they'll complain of you'd have increasing pain. So all of a sudden, you get the pain in your ear canal. And actually, if you touch the front of the ear there, it actually gets more painful. People might have got a bit of itching as well. Then you may have some discharging. And sometimes, if it's blocked up enough, you may find out that your hearing is going down, experiencing some hearing loss. Sometimes, you might have what you call tinnitus. Tinnitus just means any noise you hear in your ears. And occasionally, ringing, buzzing. Some people sometimes might describe it as a bit of a high tone or low tone. And occasionally, not common, people might have dizziness as well. Yeah. And so what you have is that ear canal, summarizing, that is painful with some discharge, and also you can have some hearing loss as well.
Right. So how do we treat otitis externa?
Good question. I think a lot of our general practitioners are good at treating otitis externa. And basically, the first thing will be to remove any precipitating factor. So, for example, if you've gone swimming and it's led to that, it makes common sense to stop swimming. And we'll normally advise people to keep their ears dry, probably using cotton wool with Vaseline rubbed around it. And that helps the healing process. Of course, it goes without saying that you need to take painkillers. And I would say any of the common painkillers like paracetamol or ibuprofen should be enough. And then this is where your general practitioner comes in. You need some topical antibiotic drops.
Topical means the
drops. So you have some drops which you apply into your ear canals. Most of the time, 7 days will be sufficient. However, sometimes people might have more and more severe pain. And it could be because the drops is actually not getting to the line of the skin. So when you have a lot of wax, a lot of collection, then you will need to clean out the ear canals to do that. And of course, to clean out the ear canals, you need to see a specialist because it should be done under the microscope.
Is it the one they call microsuction?
That's it, correct. So basically what you do is, under the microscope, you use just a soft suctioning device to suck that out. And again, it's under direct vision. And then you clear that out. And after clearing that out, it means that the drops now will become more effective because the drops will be getting to the lining of the ear canal.
Okay, right.
Yeah, there's another thing again. Sometimes the treatment might be very slow because the ear canal is quite swollen. So you can imagine if it's quite swollen, the drops actually cannot get to the lining.
Yes.
So if you put the drops in at that time, it falls off. It just flows out.
Yes.
Then you have to go to the specialist as well, because when you go to the specialist, after cleaning out the ear canal, you will now put a soft wig. You put a soft, somewhat like a soft dressing in there. And what the dressing helps is called a pope wig. Yeah. And what the wig does is that it acts as a conduit to which the drops can get to the lining, the whole lining of the ear canal.
Some viewers might be asking, what if the drops don't work? I mean, is there any other treatment option?
Yes, sometimes the drops might not work because the infection has spread beyond the lining and is going further, sometimes around the face. In that case, you need oral antibiotics. But actually, that is less frequent. Most, I would say, about 95% of the treatment will be solved by having this. And then, of course, sometimes the infection could be affected by someone being septic. When I mean septic, I mean that the person is very unwell, very high temperature, might even have glands coming up in the neck. And in that case, they will need antibiotic treatment. And then when you have a break in the skin, the bugs that are usually quite helpful can suddenly become harmful. And then, so that will benefit from that. And I'll just put a little, add in a little more about the furuncle. You know where I talked about the localized infection, otitis externa, called the furuncle. It's like an abscess, and most time they would need to be drained. So when I mean drainage, it means that under local anesthetic, so you have to numb the area, probably done by a specialist, make a cut to let out the abscess with antibiotics. Most of the time, it's caused by one of the bugs called Staphylococcus, usually causes it. So you give an antibiotics, flucloxacillin that covers that, have it drained, and then that should settle that.
Right, excellent. Okay, viewers, if you're just joining, this week we're talking about ear infection. Dr. Okpaka, who is an ENT consultant in the UK, has been talking about the outer ear infection, the things that cause them, the factors we have to be aware of. Remember, do not put anything in your ear. Do not use those cotton buds. They do predispose, they do cause infection of the outer ear. And again, if you're swimming, I'm sure you said it's called swimmer's ears.
Yes.
So people should use earplugs.
Yeah, they can use earplugs, especially if you're going into that sort of open swimming pool, hot area, some of those lovely holidays where the places are hot. It might be good to use earplugs to protect your ears.
So, this is the first segment of ear infection. Dr. Okpaka is going to talk to us about the middle ear infection in the next segment. So don't go away, we'll take a short break. We'll be back.
Meet Anne. Anne is thinking about sending goods to Africa. Her first thought came to MDS Cargo. Send goods to Nigeria, Ghana, and many more countries in Africa. Excellent customer service and after-sales support. Free London and Essex collection. Online tracking.
Fast Cargo caters for all your door-to-door sea and air cargo services from Nigeria to the UK and UK to Nigeria. With prices from 99p per kilo, you can't go wrong. For prompt, efficient and dependable service, call Fast Cargo today.
Health Corner on Ben TV by Crystalife is an exclusive show that explains different health conditions which you may not hear from your doctor. Health Corner elucidates your health in simple, understandable language, preventing you from getting ill. It explores different health issues and looks at health practices in the UK and other countries. For the educative and innovative medical show, by Crystalife.
Welcome back to the second segment of Health Corner. Today we're talking about ear infection, and we have the pleasure of inviting an ENT consultant, Dr. Okpaka, to speak to us regarding this very common health condition. Now, in the first segment, we talked about the infection of the external, which is the outside ear. In this segment, he's going to discuss a little more about the middle ear, which is called otitis media. So otitis means inflammation of the ear, media means the middle ear. So, Dr. Okpaka, I know viewers are watching. What can you tell us about the otitis media?
Yeah, just as otitis externa, otitis media means inflammation or infection of the middle ear. The middle ear consists of the eardrum and beyond it.
Yes.
And then after there, you also have the inner ear. So it's almost like an enclosed box.
Right.
And that box has a connection to the eustachian tube. Eustachian tube is that tube when we are flying that you try to clear in order to equalize the ears.
Right.
You know. And so acute otitis media is commonest in preschool children. Very, very common. And actually it's not surprising why they suffer from this, because it's due to the anatomy. We know a lot of those who have preschool children will know as soon as they go into the nursery what happens. Someone has a cold, they have a cold as well. So because of the connection of the eustachian tube to the rest of the upper airway, upper side, if you have an infection or cold, straight away it goes to the ear.
Right, because yes, I understand that this tube connects the throat to the ear, and in children it's a bit shorter than...
Absolutely. It's shorter and is actually a bit more horizontal. That is why kids are more predisposed to upper respiratory tract infection or colds. Yeah. So as soon as they've got that cold, you can imagine the eustachian tube gets inflamed. But not just that, because it's shorter, more horizontal, the middle ear also gets inflamed and infected. And that's how they get the infection. So usually what happens is that they complain of very severe pain. Lots of times, that's a lot of pain. And a lot of times the children will point to their ears, and you find out they might be unwell as well, refusing their foods. Sometimes they might have temperatures that they have rigors, so they're shaking as well. Yeah. And then that period of increased pain, of course, what we normally advise is for them to have painkillers, just something like paracetamol at home. Then why do they have the pain? They have the pain because the eardrum gets stretched and it's got sensitive pain fibers. So it gets stretched, so that's where they have the maximum pain. Then the second phase, the eardrum bursts, what we call perforation. And then that is where you notice, oh, there's a discharging coming out from the ear canal. And then the pain goes down as well as the temperature. And then the hole, which is almost like, imagine a door opening and closes, the hole heals by closing that door.
So how long does it take for the hole to heal? Because some parents might be concerned.
Yeah, it usually will be done in some weeks, but actually sometimes if the discharging continues, which is what you might call the chronic part of the otitis media, then it might take longer. But I'll be very surprised if it hasn't healed within 6 months. But most of the time, in a few weeks, it's healed.
Oh, right. Then what about the glue ear? Is it when the hole, well, when the drum does not perforate and then there's a collection in the middle ear?
Now, the glue ear can come in as a lot of other factors. But one of the factors is one, the ear infection. Because obviously, glue ear just means fluid, not exactly glue. The term glue comes because sometimes the fluid can be quite sticky looking. That's why it's called glue ear. But it just means fluid behind the eardrum. And then, what treatment do you give? Now, we talked of the same thing about otitis externa, where you have microorganisms, the bugs. So most of them are bacterial, and I'll call some of them is the streptococci, some of the other ones, which is what you find mainly in adults, and then some of the others could be pneumococcal, which you find in children, and then you have a lot of the other mixed ones like coliforms, Haemophilus, Staphylococcus.
These are all the names of different bugs.
Different bugs, different bacterial bugs. And then the treatment is usually all antibiotics, usually for about most of the time will settle for 7 days. But in the more severe ones, you could use them it could be used for as long as 10 days.
Right. So if someone's child complains of pain in the ear, it's best for the person to go to the doctor and have
Absolutely.
look into the ear.
Absolutely. Especially when it persists for more than 48 hours,
Right.
72 hours. Now, a lot of the colds children would have initially will be viral. And actually, a lot of you would have noticed if your children go to nursery, they come back, my child is having the same problems. That the nose is running, has got a cold, but hasn't got a temperature, has not definitely got a complaint of pain.
Yes.
So if they've complaint of pain and the pain persists for more than 48 hours, the child is in discomfort with other red flag signs like high temperature, rigors, which means very high temperature, so they are shaking. This is the time to go and see the general practitioner, the GP, and the GP will now examine the child, look into the ear, and if the eardrum is red and inflamed and angry, we'll start them on antibiotics.
So we've been talking about children. Does otitis media occur in adults as well?
It does occur in adults. However, in adults, it's much, much less common. Adults are more likely to suffer from otitis externa.
Really?
Yes, otitis externa. But again, when an adult has had a bad cold, very bad upper respiratory tract infection, for the same reasons they can. However, the adults are less predisposed because their tubes are longer, bigger, and more effective. That's talking about the eustachian tubes. This is what we call mastoiditis. This is a very, very important complication. It is quite rare. However, it's not uncommon. And what that usually manifests is that usually happens in children. And when it happens, you will notice suddenly that the child's ear is being pushed forwards. So when I mean pushed forwards, it's pushed off that way.
Right, so like this photograph here. Okay, there.
Yes.
You see the lump behind the ear. And
Exactly. Yeah, it's a complication of otitis media. And what happens with that is the child is usually generally very unwell, increasing temperature, and will refuse foods. And then you will notice that the ear is pushed forwards with a swelling behind the ear. It's called mastoiditis. And basically, it's inflammation of the bone behind the ear, which is called the mastoid bone.
So this is an acute, it's an acute condition, and that requires urgent attendance.
Absolutely. You need to go and see, you need to get to the hospital quickly, and you need to be seen by the specialist.
Yes.
So that is one that you go to as an emergency, and you will notice also that there might be discharging from the ear. There will be that swelling, and the ear keeps getting pushed forwards. When I mean push forwards, gets pushed up that way.
As it is on the picture.
As it is on the picture.
Right.
And then what we will do is when you get to the hospital, you see the ear, nose, and throat specialist, and what they will do is that they organize a scan, because the main reason why we are worried about this is that mastoid bone has got connections to the brain.
Right.
So that means if you don't treat it, the infection can spread to the brain.
Right.
And so that's why it's urgent. So what will happen there is that you'll be started on antibiotics intravenously. That's through the drip immediately. At the same time, you would have a CT scan, and the child, if it's getting bigger and spreading, the child will be taken to the theater where it will be drained.
Right.
You know. So you'd make a cut into it and then drain it.
So treatment here might be through the vein. I mean.
Oh, definitely will be through the vein. Antibiotics through the vein, definitely. Yeah. So it's something to take away from here. Please, any of our viewers, if you have a child and you notice spin complaint of ear pain, and at the same time the ear is being pushed forwards with a swelling behind the ear, you need to go to the accident and emergency immediately, because it needs to be treated.
So from what I can take from this, if people have otitis media, which is infection of the middle ear, and is poorly treated, that can actually complicate to mastoiditis.
Yes, it can lead to mastoiditis, but it's only a small percentage of that, because actually there are some who would have very short acute otitis media that goes straight away. But most of the time, it would have been an inadequately treated acute otitis media. But it's only a small percentage of that will lead to that. So, but the main thing is to watch out, because sometimes the transition can be quite quick.
Yes.
So please, any of the viewers, if you have your child, the ear grows forward,
Yes.
you need to do that immediately.
Right. Okay. So is there any way we can compare otitis externa and the internal one? I mean, obviously, the media one.
Yeah, absolutely, there is, because you notice some clear things in that. Both of them would have a discharging ear. In the otitis externa, you have the pain, itchy ears, and actually you may have a past history that the person has had this before. Actually, in the otitis media, you'd have someone who's had a cold,
Yes.
and then starts feeling deaf first.
Right.
Yeah. And then when it comes to the kind of discharging you have, a lot of the otitis externa will be thin, creamy discharge, while in otitis media, you would have increasing pain.
Right.
And then you would have thick, copious discharge. And when that is happening, the pain goes down immediately.
Right.
While with the otitis externa, as you give the treatment, the pain is still there, but it takes a longer time for the pain to go, because you're having inflammation of the ear canal, and that reduces. And of course, the deafness is minimal. It's only when you've got a lot of thick collection, that's where you've got the deafness.
Thank you very much, Dr. Okpaka, for coming to Health Corner. We just feel like listening more to you. Right. If you have any questions, please contact us on the number on the screen, or send us email, or check our website. Dr. Okpaka, I'm sure you are happy for me to forward any questions, especially the difficult ones.
Absolutely.
From the viewers.
Absolutely.
All right. So we are happy to partner with anyone who want to associate with us in form of sponsorship. We're happy to continue to bring this show to you. So stay tuned. Next week we're going to have another